Moving on very, very quickly. Now, one thing that we do with BBC Radio Tees, we like to point you towards things that are happening within the community, because if it's of the benefit of the community, that's what we're here for. It's part of our resident. We like to laugh, we like to joke on, we like to dig and dive and whatever. But when it comes to this time of year, vaccination, very, very important. And the one that we're going to be talking about is something that it's a disease that can be fatal. And if you get the vaccination, it's a lifesaver. Now, Peter Horrocks is the chair of the community pharmacy of the Tees Valley, and he popped into the studio yesterday to discuss the flu vaccine.
Many people will be familiar with the national offering for the flu vaccination, which predominantly, as in the past, has always been for patients over the age of 65 and anybody with underlying health conditions. The significant change this year is you can now get your toddlers, so your 2 and 3 year old children, vaccinated at a community pharmacy, whereas previously they could only have got that vaccination from their GP.
Why such a young age?
So the toddlers and children in general are great spreaders. They're not always the most hygienic little devils, are they? They don't always wash their hands. They don't blow their noses, and it becomes rife when we get into winter of children spreading viruses. And unfortunately, the flu virus is one that is spread that way as well. And also, unfortunately, children, particularly the young children, can be some of those that are most likely to end up in hospital with a hospital admission with the flu virus. So they're a really important age category for us to protect.
Younger and older, they seem to be the ones that have been the most vulnerable out of flu.
That's right, yeah. The young, the old, and then people with, and obviously the people with respiratory conditions such as asthma and COPD. These are the people, those most vulnerable in our society, that we need to protect.
Now, you're pushing open door with me, and we've had this conversation many, many times. I think from a young age, I worked for a local authority, and it was part of the everyday practice at the local authority nurse for Sedgefield District Council. Once a year, you'd be trooped out to Green Lane in Spennymoor and you get your flu jab, because it made common sense for the employer to mitigate any risk of their workforce, their staff getting flu. Why is it important that people of my age, I'm in my 50s, but maybe 40s, 30s, to get the flu jab?
Like you've highlighted there, you don't want to be off work, but it also then is how it can affect the rest of your family, and could you spread it to those who are more vulnerable. So we do have a lot of responsible employers across the region, including the councils and the NHS, that will invest in a private vaccination for their staff. It's really important for everybody to consider having the vaccination if they want to remain fit and well this winter.
And you can do it. You could go into your local community pharmacist and get the flu vaccination.
Yes, you can. It's an optional service, but I would say the majority of pharmacies that are offering a NHS winter vaccination service will also be offering a private vaccination service. And the private vaccinations have been open now for the last month, whereas the NHS scheme starts on the 1st of October.
Can I ask how much it would cost?
Typically, you might find a vaccination for around £20.
And that £20 against having a week off work, it's not bad, really, is it?
Yeah, it's a good investment. I'll certainly be uptaking my private flu vaccination this year.
As a clinician, as a pharmacist, do you get frustrated with some of the information that gets passed around on social media through all sorts of vaccination?
Yeah, there's a lot of misinformation out there, and people referring to what they've seen on social media or what does Dr. Google say. If we think of the public health interventions that society can make, number one, the most important thing is having clean water, but secondly, the introduction of vaccinations as part of healthcare is the second most important thing that can benefit the health of the population.
I'll be perfectly honest with you. I was brought up by my grandparents, and my gran didn't agree with vaccinations. I had none of my... So, the old clock on the arm. Yeah. I was the only one in our school who didn't have it done. So this is not a new phenomenon. People have always had that reticence of vaccines. Is it an educational thing?
It is an educational thing, and it's one of the great reasons why I enjoy coming here, Gary, to speak to yourself and speak to the listeners, is to raise the awareness and the importance of vaccination. What we have seen over the years is some diseases lead to eradication because of effective vaccination programs. But unfortunately, what we are now seeing is some diseases are coming back.
Like measles?
Like measles, for example, yeah, through people not taking up the offer of the vaccination campaign that's there.
I'm always fascinated with the flu vaccine, is because it works. How do you decide what goes into the vaccine every every year? Because I think this is amazing.
Yeah, so there's a lot of time and effort put into the production of flu vaccinations on an annual basis, and because we live in a world where it's winter in the northern hemisphere when it's summer in the southern hemisphere, the healthcare environment can learn as a whole. So the strains of flu that were circulating in Australia during their winter are likely to be the strains that are circulating in the UK this winter. So a lot of time and effort goes into studying what is happening to the various strains of flu across the globe, and that feeds into updating the vaccine every single year to be effective against the strains that are most likely to be circulating.
And the protection it gives to older and younger people is unbelievable, isn't it?
Yeah, I mean, one fact here from the UK Health Scrutiny Agency is it's estimated that last year over 100,000 people were protected from being hospitalised in England last winter just from having their flu vaccination. Now, on the contrary side to that, unfortunately, there are also more than 7,000 deaths associated with a flu-like illness last winter as well.
And that plays into anyone who has an underlying illness, and this is where it can give that extra layer of protection.
That's right, yeah.
Would you suggest, because I know there'll be people listening now going, well, yeah, but I know somebody who had this, and I know somebody who had an injection and had a vaccination, and this happened. Is it worth, if you have a concern, to sit with your clinician, to go to your pharmacist and just have that honest conversation with them?
Yes, certainly. If you're unsure at all, book that time in with your GP or with your community pharmacist, and they'll take the time to go through and help to alleviate your concerns. Or if the case is, understand whether you are contraindicated and not suitable to receive the vaccination.
And when does the NHS for the over 65s and the 2 to 3 year olds with the nasal spray, when does that kick in?
From the 1st of October, so on Wednesday this week.
So you're going to be busy?
We're definitely going to be busy.
Is it a walk-in service or do you have to book?
Most places will offer a walk-in service, but the best thing to do is to actually use the NHS's booking system, because that helps people plan for their stock and their appointments. So if you visit the NHS website, find a NHS flu jab, you'll be directed to the booking page, which lists all the availability that is available to book.
And because I know there's a lot of digital poverty in our part of the world, if you just phone your local pharmacist, they'll be able to point you in the right direction.
That's right, and the NHS also have a call centre on 119, which does have access to the booking service as well. So
in your role, do you go around and coordinate the voice for all the pharmacists in our part of the world?
Yes, as the chair of Community Pharmacy Tees Valley, I'm here to champion and promote what community pharmacy can do to help support the population across the Tees Valley. You do much
more than just handing out aspirin, don't you?
We do certainly need to promote it. There are a wide range of services available from pharmacy, which doesn't just involve the dispensing of your prescription. We've had the Pharmacy First scheme that came into fruition about 18 months ago, which allows patients to see their pharmacist for some of the most common conditions, which allows you to not have to kind of be blocking up an appointment at a GP practice, but you can see a healthcare professional who will assess your condition and decide whether treatment is suitable from the pharmacy or whether you need to be referred higher up the chain.
Come on then, this is my favourite time of the year. Let's myth bust. Give me the myths around vaccination, especially the flu vaccination.
So the most common thing we hear is a patient will say, well, last year I caught the flu because I had the flu jab. You can't catch the flu from the flu jab.
Zero chance.
Zero chance. The injection that we use is what we call an inactivated vaccine. So it doesn't have a full particle of the flu virus. So it's impossible for you to catch the flu from the flu injection. Unfortunately, at this time of year, there's often lots of bugs circulating, including the flu, and people sometimes might associate the fact that they've had their flu jab with catching a virus the following week or that period of time. So they sometimes make that incorrect link that they caught the virus from having had the flu jab. The typical side effect we would expect it from having your flu vaccine is a little bit of a sore arm and a little bit of a fever for 24 hours. That would be common. That's because we've triggered your body's immune system, and that's what kind of triggers a little bit of a fever and makes you feel a little bit groggy for 24 hours. And that's only some patients. Many people don't have any side effects at all.
Well, look, thank you very much for your time for coming, Pete, and anything we can ever do to promote public health, we're always here on BBC Radio Tees.
Do we want to do your vaccination as part of it?
Absolutely. So it's that time of year. I've got my jumper on. Shall I take my jumper off, Mr. Horrocks?
Yes.
Do I have to call you Mr? Because
no,
professional
fine.
mode, right? Jumper off.
So the vaccination, Gary, as you're aware, it goes in the top of your arm, in your deltoid muscle. So if you can just roll your sleeve up nice and high for me.
Muscles.
So this is this year's flu vaccine for patients who are under the age of 65. Okay.
Yes. Just, I'm kicking on, mate. I'm 56 next year.
So you've never had any issue with receiving your flu vaccination before?
Never.
No.
Absolutely not.
You don't have any particular questions or queries about that either?
Happy as Larry. No, I'm good.
That's great. Okay. So what you do is you'll feel a sharp scratch just in the top of your arm there. And that's great. So that's you all protected now, Gary.
And there we go. For another year. I've never missed a year. I think it was 17 when I first got it done at Sedgefield District Council, and I've never missed a year. And I don't think I've ever had flu. Yeah. I genuinely, I've had a bad cold.
Yes,
but I think I could tell the difference. I've seen people with flu, and it's just not good. And especially if you've got that underlying problem, it's a really serious thing. And I think we take it for granted that I'll be all right. He's only got flu. It's like it can be serious.
It certainly can. It's one thing that's not to be messed about with. If you do catch the flu, you do need to seek medical attention if your symptoms are worsening. But it's a disease that we can have effective treatment and easily done to protect our health over the winter.
There you go. Peter Horrocks, community pharmacist there. Just blowed a few myths there. And I'll be honest with you, I feel a bit groggy today. I had it done yesterday. Arms a little bit sore, and I do feel a little bit woozy, a bit like the tail end of when you've had a hangover. But I've always been like that, and I know what it feels like. So plenty of water. I took some paracetamol just to keep myself right. And I know I'm protected now for the next year ahead. And that's what we're here for, BBC Radio T, just to put you in the picture of stuff that's happening, where you can get it done. Those inoculations will come into play as the 1st of October, as Peter said, for over 65s and for 2 to 3 year olds. This is your BBC Radio Tees.